Well, my name is Tresha Baldwin. I've been a physical therapist for about 14 years. Graduated from the University of Oklahoma, and I have a practice here in Chandler. Our main location is in Chandler. We have a pool at that location and then a pool at our Tempe location as well. Went into private practice back in 2001 when I moved to Chandler. And in 2002 is when we actually added our first pool. And adding that pool was probably one of the best decisions that I could have ever made for that practice. It really opened up opportunities for us to help patients that couldn't be helped by a land-based program. And when we added that pool, we started getting a lot of different referrals, different patients, different types of diagnoses that were referred to the pool. And in my experience, I have seen a few patients that have ST, but again, not a lot of them end up making it our way. But it can be very helpful for patients that have specific movement disorders, balance disorders, chronic pain, fibromyalgia, and then all of your other musculoskeletal problems that you could have that can be treated in the pool. One thing to remember though as we go through, and by the end of this we are going to go through all of those exercises that are in there. I wish we were in a pool setting, but we'll at least simulate some of the exercises. But every patient is going to respond differently. So the aquatic setting may not be helpful for every individual. If you are not comfortable in the water, if you don't know how to swim, if it creates anxiety for you, sometimes it's not going to be the best choice. With different types of muscle tone patterns, it may respond poorly in the water. So it's just something to try with different patients. We've tried it. Sometimes it's very successful, and sometimes it's not a good option. My goal today is to provide you so today's goals, oh, and that was a picture actually. This is our pool in Chandler. So this is me working with actually my front office assistant in the pool. At Chandler we have just a 10 by 20 pool that goes from 4.5 feet to 5 feet deep. And we keep it at about 90 degrees. Today's goals, I want to provide you an understanding of the different properties of water so that you can develop your own program. This is usually a talk, and I kind of changed it obviously a little bit, but it's usually what I teach a new therapist when they come in, how they can teach their patients how to exercise in the water. So we're going to go through the different properties of water, how you can make your pool or a pool at the Y a functional gym. It's not going in and doing an aerobics class to jazz music. It's getting in and learning how to use the water to make it a functional program. Also, towards the end, I'm going to touch on some land-based approaches to ST. We have some therapists at our clinic that are trained in what's called postural restoration, and I'll just spend a little bit of time on that as well. The biggest thing when getting a person in the pool for the first time is getting them motivated. If they don't understand why they're doing something or why that something is worthwhile, they're not going to do it. So the biggest thing is when I get a person in the pool for the first time, I want to tell them, okay, when you do this exercise, you're exercising these muscles and these muscles, you're challenging your balance, your central nervous system. So once they really understand the science behind what they're doing, it's more than just moving around in the pool, and it's something that they can find worthwhile. And that's what I want you guys to understand today. Water can actually be harder than land exercise. One of the biggest myths that patients come in and they're like, well, I'm exercising in the water because it's easier. Or my doctor wants me to do that because I can't tolerate land. And what we're going to learn today is how to use the pool so that you'll actually realize what a hard gym that it can be, as hard or as easy as you need it. Okay, properties of water. Today, the main properties we'll focus on is buoyancy, surface area resistance, and speed. So buoyancy we can use with a dumbbell like what I have on the slide there. And this can make it harder, but your own legs, your own adipose tissue, your own osteoporosis, any of those things are going to make you float already. So you're already going to be working against those things in the water without even actually adding a tool. Surface area resistance, if the bigger an item is, the harder it is to move in the water. So if I have an open hand moving in the water, that's going to be easier than if I close the hand and I make the surface area resistance more. I can add a paddle that's open, and that paddle is going to be even harder than my hand. When you close the paddle, that's going to create even harder resistance. So that's surface area resistance. And then if I take this paddle and I move it slowly in the water, that's going to be more of a relaxing, rhythmic movement that might help me relax, but also stimulate muscles. The faster I move this, the harder it is. It's just like adding more weight onto my dumbbell. So adding it all together, one simple movement, this is one of the exercises on the handouts that we have, is when we're doing this type of an exercise here, I've got my quads going, I've got my chest and my back muscles going at the same time, I have my shins and my calf muscles, I have my abdominals, my glutes, my balance, my proprioception. As I go forward in the water like this, I'm going to want to fall backwards, so that's going to get my proprioception going. And my calves, as I go forward here, it's going to pull me forward in the water, and I'm going to have to contract the opposite group of muscles. So when you're doing something just as simple as this in the water, you're actually stimulating multiple systems all at once. And that's where really the benefit of aquatic therapy comes in, is when you're in the water doing simple activities. If you plan out those activities similar to what the exercise handouts that I gave you, you're going to be able to stimulate multiple systems with functional movement patterns, which is going to help you relax, decrease tone, and decrease pain. So that's the idea behind it. Also on this slide, I wanted to touch on muscles of respiration. When you're in the water, you have hydrostatic pressure pressing against your body. It's going to make it more difficult for you to breathe, which is also going to help you to slow down your breathing patterns and breathe more normally. With that, it's going to also help you relax your accessory muscles in your neck. A lot of us, when we're stressed, or depending on what type of condition that we have, we're using these muscles here to do all of our breathing versus using our diaphragm. So when you get in the water, your muscles of respiration are actually challenged more because of that hydrostatic pressure. So it's going to help you breathe better and relax those accessory muscles. Also, hydrostatic pressure can be very beneficial for patients that have, or for people that have swelling in their extremities. So if you're not as active, you have chronic swelling in your extremities. In 4 feet of water, it's the same as having, hydrostatic pressure is the same as having 2 ACE wraps on your ankle. So it's going to help you get rid of extra fluid, but also at that same time, getting rid of that extra fluid, you need to make sure that you're also staying hydrated, especially if you're exercising in a pool that's heated. Most commonly, again, we keep our pools at about 90 degrees. If you're not at a therapeutic center, you're probably not going to find a pool that's kept at that temperature. If you can find a pool at that temperature, it's probably going to be the best bet for you because it's going to also help relax versus being one at about 82 degrees. This can be deceiving. On the handouts, a lot of the exercises may look the same. So it looks like you're doing the same motion with just maybe a different tool, or maybe not using a tool. If we do an exercise in the water and I have a dumbbell and I'm going downwards and I'm pulling this under the water, I'm having to pull the buoyancy, pull through the buoyancy, that's going to exercise my underarm muscles on the way down, and on the way up it's still going to be exercising those same muscles. Whereas if I take a paddle and I do that same exercise, I'm going to be pulling down using my muscles under my arm, and on the way up I'm actually going to be using my deltoids. So it's actually a different exercise. If we move those items in front and I have to pull this down, this is really going to challenge my balance. It's a really difficult exercise to do. If we were in the water, you could really appreciate it. Pulling this down is really going to throw you off balance. So pulling it down in front versus out the side is actually, it looks very similar, but you're actually going to challenge different systems. So let's pretend we're in the pool. This is my little disclaimer, but you guys were all up exercising earlier, so we won't go through that. But if you feel comfortable to stand up and go through some of the exercises, that's fine, or you can do them from your chair, or you can just watch me. We're going to start with, there is one thing I did want to focus on. A lot of times with cervical patients in the pool, I am hesitant to use tools with them because they're going to grip onto these really tight. And so usually I'm constantly telling them in the pool, quit death gripping the item. So if you're grabbing onto something really hard as you're pulling through, it's going to actually increase the tone in your neck. So be very careful if you do decide to use a tool when you're in the water. You need to constantly remind yourself to not grip onto it as tightly. An option also would be this type of a tool, which is basically just a web, which is going to increase, brand new, so I can't get my hands on, which is going to increase your surface area resistance. So this type of a tool, where I'm using it in the water, allows me to not have to grip onto anything, but it's actually giving me a little bit more resistance. So those are other options as well. I was going to put in your handouts where you can get a lot of this equipment. I didn't add that on there. If you guys are interested in finding where you can get it, you can always call our clinic. I did put our patient services coordinator on that. We carry it at all of our clinics, and we don't mark it up any. So we just sell it at cost, and we keep most of it in stock at both of our locations. So, but if you have questions, just call us, and we can put you in the right direction on where to get it. Okay, so we're going to go through all of these exercises. And I just want to, this is, whenever I put a new person in the pool, I always want to tell them each exercise, okay, this is what you're doing. This is what you should feel. So that's what we're going to go through with each one of these. On the wide claps, this is a great warm-up for patients. So when they're in the pool, I get them in a ready position. And usually you want to be at least at chest level in the water. If you're not comfortable being that deep, you can have it at waist level, but it's going to be very difficult to do the exercises. If you find that you're a floater, you can't keep your feet on the bottom if you're at chest level, then they do sell cuff weights that you can put on your ankles to help keep your feet down. So the first one is in ready position, and what I tell my patients is to put their bottom out, bend the knees, arms out in front, and they're going to slowly go back and forth. And this is going to get them comfortable in the water, because when I go forward, I'm going to go forward. And when I go back, I'm going to go back. And I gradually tell them to increase the speed if they can, but to keep it comfortable. The next one is the same thing. We go down here, up and down. And what they're going to feel here, when they go down, they're going to feel their abdominals kick in. And when they go up, they're going to feel themselves go backwards. So forward, it's going to pull them forwards. They're going to get an abdominal contraction. And backwards, it's going to throw them backwards. It's hard to understand when you're on the land. The biggest thing for a therapist when we put someone in a pool, we have to remember that all of the rules of kinesiology are kind of out the window. So when you're doing different exercises in the pool and you think well, that should be tricep or that should be bicep, if you're on land, it works that way, but when you're in the water, sometimes it tricks you. You're actually using opposite muscles. Side-to-side arms, again, in that ready position. This is going to protect your back. It's going to engage your glutes and your hamstrings. And this one is going to just be a side-to-side motion. And with my back patients, I tell them, please don't rotate. Keep that belly forward. Keep your belly button forward and go around it. And what this exercise is doing is it's causing rotational movements. As I go this way, it's causing a rotation. It's challenging my balance. You're going to feel it head to toe. Okay, lunge, alternating arms. You want to do this one both ways. In the lunge position, it's just like this. Same thing. As I go this way, it's trying to twist my body one way. As I go this way, it's trying to twist my body another. Constantly telling my cervical patients, relax your shoulders. Get them out of your ears if you can, and relax your hands. And on that one, we want to do both ways because it's going to exercise, again, opposite muscle groups. The next one I like to do usually leaning up against a wall. So I'll have patients lean up against the wall and just do a gentle hamstring stretch, out and down. And so it's just a nice, easy stretch. It's an active stretch, and I just tell them each time, gradually try and get your foot up just a little bit higher each time. And then the next one, it's a similar motion where they're against the wall and they're just gently bringing their leg out and down. Again, these first ones are all kind of warm-up exercises. Okay, front pull-downs. And the picture, it shows using a dumbbell, but I did put notations on there that you could use a dumbbell, a paddle, you could use the gloves that we have, or you can use nothing at all. Especially your first time in the water, you're probably not going to want to use anything at all. Usually I don't use tools with patients the first time. So with this one, it's a pull-down motion. Again, it's really challenging your balance, and it's challenging your abdominals. When you're pulling this down in the water, you're going to feel these muscles kick in, and it's going to want to throw you backwards, especially with a dumbbell.
You do both arms at the same time?
We do. I couldn't carry everything in.
Okay.
So usually, sorry, I just brought in one of these. But yeah, usually you're going to do both arms at the same time. The next one is a punching motion. The punches, again, you can do with a paddles or with the dumbbells. With the punching motion, I would bring those under the water, and I would be doing a punching motion here. This is actually exercising this part of your arms, our favorite part as ladies, because you're actually pulling it down, and you're having to hold it down underwater. So you're going to get a really nice tricep burn by the end of that. Or you can do the punching motions with the paddles. And if you're doing a paddle, it's actually going to pull you back and forth in the water, and it's going to cause more of a rotation force at your trunk. So different motions, different tools. Usually I will have, these are the handouts I usually give a patient when they go home. And I'll circle what tools I want them to use and how long to do them. And a lot of times they're doing the same motion, just using different tools.
Tresha, on that one was the weight vertical? You're
This
holding
one?
it, yeah. No, the other one. Yeah, that one was
Yeah.
good.
Yeah.
that
So
one
it's
you're doing
this way.
and then-
I guess that way would kind of be hard on your wrist, I think, a little bit. So this way. And actually, when you see this dumbbell, this would be a really hard one to do with that exercise. You would probably start with a smaller one. These come in several different sizes. But for that one, I would say most of my guys can't use this size of a dumbbell underneath the water to do that type of an exercise. This is actually, though, except for that exercise, it's probably the ideal size because it's the most versatile. You can use it to actually balance on, but it's a good size. Also, an important thing here is when you're using your surface area, it's not going to do me any good if I'm doing this. Okay, you've got to turn it in the direction that you're going to. Now, I know you laugh, but I have to correct a lot of people doing that. So I'm like, no, that's easy. So the same thing, if I'm doing this type of a motion, it can't be this way because it's just going to slice through the water. So the side pull downs is the next one, which I kind of went over earlier. The side pull downs with this one, again, underarm on the way down, underarm on the way up. If I do it with the paddles, it's actually going to cause me resistance down, and then it's going to do the top part of my arm on the way up. Shoulder rotation. This one can really only be done with the paddles or the glove. It says on there just paddles, but this one is specifically to work on the rotator cuff in your shoulders. And so you'd want to have it in this direction, back and forth, or you could be doing a paddle. But we usually don't do that one. It's not going to really be of a benefit to the shoulder as much or the rotator cuff with the dumbbell. The next one's the tricep press down. It's just that motion of pushing it down in the water, like this. Again, you can do any of these exercises just with your hands. So just with my hand, I can do this type of a motion. And that's probably where you would want to start. But I just wanted to familiarize you with some of the tools because it does make it more fun. You've got things to kind of play with when you're exercising. But that's just a tricep press down. And it's actually working that tricep in both directions. Okay, side leg kicks. Pretend I've got two of these in my hands. One of the biggest problems with most patients in the water is their balance. And so a lot of times if they're doing kicking motions, I have them hanging onto the side, or I'll give them two of these to hold on to so that they can balance on them in the water. When they're doing this, they're actually getting a great shoulder workout. It's working on their balance, it's working on their proprioception. So they're actually getting an arm workout trying to balance themselves while they're doing a kick exercise. And sometimes it's one of these with your hand on the edge of the pool as well. So it just depends on what your ability level is in the water. With the kicks, the biggest thing that you have to think about is intent of motion. So when you're exercising, I can't stand it if I have somebody just doing this. Okay. Try and remember, in order to make it worthwhile, you need to pick a stopping point and a starting point. And that's even important with your arm exercises. If you can tolerate it, you want to pick points to where you go out and in, out and in. That's going to make it harder. If you're just starting, it's fine. It's fine to do this type of motion. You want to get used to it. You want to graduate yourself up in your program. But when I want to make it hard, I tell my patients, put some intent behind it. Pick a stopping point and a starting point so that when you go, you're out, in. Same thing with the leg. It's not just doing this, it's push, pull, so that when you're doing the exercise. I see a lot of aerobics classes at the gym that I go to, water aerobics, and they're just kind of going through the motions, and I'm wondering, they're just wasting time at social hour for them. The next one's just a front kick. The front kicks, it's very important that you stay within your limitations of your muscles. You don't want to go all the way up to where your hamstring stops you. You want to actually keep it low. And that's why in the picture it shows that exercise kept low. You don't want to take it all the way up to your end ranges of motion. Another wonderful tool that we use is and that's me on a stool with one of these around my waist, are the flotation belts. The flotation belts are incredible. It's an incredible tool, especially for someone that has ST, because when you're on a flotation belt in the water, you have your feet up, you're actually using your head to control where your body goes. And so it's actually, it can be, again, it just depends on the patient, but it can be a really great tool to help with those riding reactions. So if I'm working with someone on their balance and also working on their neck, when they're in the water, it's hard to show, but if I have that flotation belt on, my feet up, and my arms are out here, I'm using my head to pretty much control. If I look down, I'm going to go face first in the water. If I look up, I'm going to go backwards in the water. So your head is your controller when you're using a belt. You're not going to get the same benefit if you are using a noodle. So you see a lot of people, I didn't bring a noodle today, but those little noodles that you put under your arms. Those are, you're just kind of hanging out on. You're not really challenging yourself as much as you would with a belt. And there's all sorts of belts out there. You just have to find one that's comfortable. But to make it even more challenging, and I don't think this is in your handouts, what we'll do is we'll have a patient balancing with their feet off the bottom, and then if we have them bring their arms in, all of the control goes into their head. So it's their head that controls exactly where you're going to go. So it's a very good tool for balance and for neck. The belt, it just shows some different exercises that you can do. Once you're comfortable actually balancing in the water and using your head to keep you upright, again, if your arms are out here, that's going to be easier, but it's still going to be very functional. If you're not able to get comfortable in a belt, then the noodle will work. It's going to work just fine for you. But this just shows some bicycle exercises. So we've got a patient doing multiple things. They're balancing in the water, they're keeping themselves from going face first or backwards while they're bicycling. While they're doing heel digs is the next one. The one in the bottom left-hand side is just a scissor where you're bringing your legs in and out. And again, any of these can be done with the belt or with a noodle, depending on your comfort level. The floating soldier is just having your legs straight, and taking them back and forth like this in the water. Again, keeping your speed and your intent behind your motion. And then the last one's actually a really tough one. I don't end up giving that one to a lot of patients. It's a great cardio exercise. You can get yourself in 4.5 to 5 feet of water is usually deep enough. You're in a floating belt, and you've got your paddles going, plus your feet marching in place. And it's a great, great cardio. Hip circles. This is on the last page, and this is basically an exercise where you just have your legs going in circles both directions. You'll find that one direction is actually quite a bit harder than the other direction. And then squats at the edge. A lot of times we will have patients holding onto the edge of the pool and doing just a squat exercise on the steps. And then the tray pulls. The tray pulls.
Can you back up?
Sure.
What about that? Explain a little bit more about that squat at the edge.
Well, it's just.
You have to have a step.
Well, it depends on your pool. It depends on where you're at. At our pool, we have different steps as far as to get out of the pool that are built in. And so if you are not able to, if we've got a patient that has a really, really bad, say, knee problem or pain, we're just going to have them on the bottom of the pool and say the level's here, and they're just going to be doing a small squat. Making sure, really pay attention to the postures that are in those handouts as well. Making sure that when they do the squat, their bottom's going out versus forward, so just like the picture. And then as it gets easier for them, we can bring them to a higher step. so that they're doing actually, maybe they're starting here and they're going down into the water and up. So it's just a simple squat. Now this is a $30-some fancy item, and at our clinic we have one of these at each pool, but then we give our patients cafeteria trays, which I think you can get at IKEA for 99 cents. So the cafeteria trays work just as well. You can't really adjust the resistance. These will actually open and close, but they work just fine. And the cafeteria trays, I don't know the exact order. I'll go through the exercises we usually do. Bending down in the water, so this is under the water, and we're going back and forth here. And that's going to pull me back and forth. So it's really great for our back patients as well as neck, shoulder. I mean, it's going to affect so many different systems in the body. And then another one is going side to side. So this is going to cause a rotational force. And then the last one is a simulated lift. So I make sure that the patients are good posture, bottom out, neutral spine. So I want a little bit of a curve here. And then I have them do simulated lifting up and down in the water. So this is a tray, a cafeteria tray will work just fine for those. But really the key with the aquatics, I know it looks like, well, you're doing arms, you're doing legs. It goes back to when you're doing these exercises in the aquatic setting, you're challenging so many systems at once. It's actually going to trick your body into performing those exercises and performing those motions with a more normal tone pattern. It's going to make muscles work that don't want to work because they have to keep you upright. So you're just, that's the benefit, is that you're just doing so many different muscle groups. Whereas if I'm doing this on land, I'm not doing anything other than my shoulders really. If I do it in the water, it takes it to a whole different level. Any questions about the exercises?
Can you show the ready position again? Just talk a little bit more.
Thank you. I should have focused more on that. The ready position, knees are bent. My weight is going through my heels. I don't want to be on my toes in this position. My weight is through my heels, and my back has a slight curve in it. I don't want my bottom underneath me like this and slouched. I want my back, my bottom out, so that it's a slight curve, not overly curved, just a slight curve. So that's that ready position, just a slight bend in the knees, weight through the heels, and a little bit of a curve.
And is your stomach tucked? Are you using your tongue?
It's going to be, once you start doing it, that would be perfect. You know, going to bed, usually that's a 20-minute, okay, learn to tighten your abs while you're standing in that position. So, but in the water, it's a lot easier to have a patient tighten their abs because they have to. It keeps them from falling over. So it's a lot easier to train those core muscles. But yes, actually that would be ideal, is if you're in this position, you're actually tightening up on those muscles. So great question.
Are we ready for more questions?
Sure.
Okay. I saw some other hands around here earlier, so who else?
I've got one question, Tim.
Go ahead, Jim.
On the floating bicycle, floating heel dig, and the floating heel scissors, you're sitting on a chair. Now, are you supposed to have a chair in the water, or do you do these?
No, I just didn't have a way to simulate it for a picture. So I wanted to show that you should be slightly leaning back with your head down, and then your feet are slightly in front of you to do the exercise. If you're in the pool with a belt on or holding onto a noodle, you're going to be floating. So, so that's why, yeah, I couldn't float. No.
Hi, I was wondering where you would purchase paddles that you have. We have the dumbbells, but we don't have the paddles.
On the last page of your handouts, it has a phone number for our patient services coordinator, Cheryl Hunnell.
On page
Okay?
It's on, oh, I'm sorry, on page 6. I forget the handout. The exercises are at the end. Give her a call. She's in the office, I think, until 5 every day, and she can give you those contact numbers to purchase those. If you live near one of our clinics, you could call either our Tempe or our Chandler location and see if we have any in stock, and we'll just sell them to you. You might at least save shipping on it. But again, we don't mark ours up if you need to get the tools. I know that Chandler's out of the paddles right now because I had to actually grab one out of the water before I came, but usually we have them in stock, or she'll provide you with that phone number.
Okay, what's next? Any other questions?
Is there more resistance with the tray or with the paddle?
The tray is actually quite a bit harder than the paddles.
In the past, all I've been able to do is water walking in the pool, and that has helped a lot. So now if I extend that, does my physician recommend what can be added to the water walking? And I have access to a water walking pool where I live.
How deep is the pool?
It starts at 3 and then it will continue, but you can get it up to your chest, and I gradually move to make the water resistance a little higher.
It's really dependent on you. As far as, that's one of the things I think I put in the disclaimer or whatnot. Please don't go try these if you're being treated for a medical condition or if you're on medications. There are many different contraindications to water exercise. You should always do it under the supervision of someone else, especially if you have any sort of fainting problems, seizures, obviously, and those types of, or heart conditions. So if you are under any sort of care from your physician, it would be a good idea to ask. Also, if you've only been able to tolerate water walking, I wouldn't necessarily say, let's go out and try, go buy all these tools and go start an exercise program. I would recommend that you would first try, again, if your doctor says it's okay for you to do these exercises, because again, it's going to get your heart rate up, it's going to challenge your respiration, if you have a heart condition, all of those things. Discuss it with your doctor first, but I would try these exercises without anything at all, just with your hands, without actually going out and buying tools and whatnot. And if you're really concerned about it, or I would really recommend getting with a therapist that understands aquatic therapy. So they could actually, and sometimes a patient will come and say, I have a pool, I don't really want to come here to do it, I just want to learn what to do specifically for me. And I'll put them in the pool maybe twice, and we'll go through all the exercises so they know how to do them, so they're very comfortable with them. I give them their handouts, I circle the ones I want them to do, I mark off the ones that I don't based on what their health history and other problems are, and then they're gone in 2 visits. So really, it's hard that when I was asked to come in today to provide you some information, it's tough because really, I would say, I need all of you to come see me so that I can give you each your own program. So I wanted to at least provide enough information so that if you wanted to go experiment in the water and try some different exercises, you would at least leave today with some ideas of what you could do. Hope that answered the question.
Do you recommend wearing shoes when you exercise in the pool?
It's really dependent on the person and the pool. If you're in a pool that has a really rough, like pebble tech floor, you're probably going to want to get a type of water sock or shoe. But some patients don't like them because if they're trying to do the floating exercises, they cause a lot more resistance and it makes it a little bit more difficult for them to do it. So it's just really your preference.
How important is the water temperature? I mean, I know you mentioned you do it at 90 degrees, but if you don't have that available, what's the difference between?
Just basically your comfort level. If you're in a cold pool and you're like this, when you get in and get out, you're going to be miserable. So, but maybe if you're not as sensitive to the cold, it's going to be tolerable for you. So it's just really, again, it's your preference. I can tell you that our patients that come in regularly for aquatic therapy, they know if it's 89 degrees versus 90. So they're very sensitive to the temperature, and we know about it when it's off. So it is pretty important if you can find a pool that has that temperature. But if it doesn't affect you as much, then it might be fine if it's colder.
Yeah, one comment about pool temperature, and I know this from my own experience, is that if you're in cooler water, it does make your muscles contract, which adds on to your spasmodic torticollis. So you're better off looking for a warmer temperature pool if you can find one, because then it minimizes that inherent body response to reduced contraction. Any other questions?
Are there people like you around other places in the United States?
There should be, yes.
Do you have a professional training?
We do. You could, the American Physical Therapy Association, if you were to put American Physical Therapy Association, I probably should have put that website on there. They would be a good resource to possibly help you find a pool. I would, For ours, it's, you know, you just go to the phone book and you look up aquatic centers. You could call some of the physical therapists in your area and ask them who has aquatic. They're going to know. I know who else offers aquatic throughout the whole valley. So
I belong to a gym and they have a pool, and they have these group exercises for the people who have arthritis, and from water walk to more extensive, harder exercises. But it isn't really, I don't think they even know what we're gonna call this, you know, so it isn't really geared, you know, specifically disability for certain. I mean, I would like to get someone like you to work with me, you know, she's on a one-to-one. Lived for a while, so that's wondering. And I live in Seattle.
you live in Seattle? My first practice was in Tacoma. If you want to leave me your information, I'll try and find you an aquatic therapist there, because I still have friends back in Washington. I can make some phone calls. I can't think of somewhere off the top of my head, but, and I really recommend, you really should be with a physical therapist that understands it. If you go with a trainer at your gym or something like that, you're right. They're not going to really meet your needs. But yeah, if you'd like to leave me your information, I can try and help find someone there for you.
How many minutes do you spend with the patients in the water?
Well, it's very dependent on the patient. We like to get them in there for an hour. So we like to have them in there for an hour. When we are making their home program for them, when they're not with us, we ask them what they're willing to do. So we try and work their program around what they're willing to do. If they're not going to do it for an hour, then we're going to pick enough exercises to fill the 20 or 30 minutes they're willing to do once they're done with therapy. So, but usually in our clinics, we try and keep them in the pool for about an hour.
How many times a week?
As far as therapy or a long-term program?
For doing the exercises, how many times a week would you recommend?
I would recommend 3 times, so that you have a day of rest between. That would be ideal. But these types of exercises, you're not going to get them up to a level to where you really have to give yourself that day of rest between. I have some patients that they like to get in their pools every day, so they'll do half their program on Monday and half of their program on Tuesday, and so they're spending about a half hour each day. But again, it just depends on what you can do. I'm a big fan of when people ask me, what's the best type of exercise, my answer is the type that you'll do. So if it's Tai Chi, if it's Pilates, if it's a yoga class, you know, it's whatever type you're going to do is the best kind. But 3 times a week would be great if you could commit to that.
I have one question. I know that medically prescribed PT is reimbursable by many insurances. Is Aqua PT reimbursed by insurances?
Aquatic therapy is reimbursed, at least in the state of Arizona. We don't have any trouble with reimbursement with any of our plans. So some will require us to get a certain type of authorization prior to doing aquatic therapy, but we're on every plan, I think, except for Banner and APIPA or something. So we're Medicare, all the major plans recognize it as something that's reimbursable. Good question.
I was just going to add to that. I'm a physical therapist in California, and it depends on especially a lot of you people, yesterday we talked a lot about Medicare, and your Medicare intermediary is going to determine the rules and regulations for pool therapy. So in California, it's a lot more strict.
Is it?
For aqua therapy, we have a brand new intermediary, and their standard is about 8 sessions. And in the pool, you have to have some land therapy following it, stating you're getting a functional change in their status at home. So if Medicare is your intermediary or your insurance, then there's going to be a little bit difference depending on who's defining what the federal government allows. So in each area of the United States, a different person does that. So you would have to check with the insurance and the Medicare in your area.
That's a very good point. Yeah, apparently Arizona is a little bit more lax. I know some of our plans, they'll say, well, we won't pay for it if you bill it as aquatic, but if you bill it as therapeutic exercise, we'll pay for it. So there's, again, it's all the insurances, they do have different rules, and looking into your specific insurance before you end up with a bill would be definitely a good idea. Great point. No more questions?
Okay, well, that was was a great presentation. Thank you.